Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, April 17th, and this is my daily briefing. We've had a total of 36 cases to date in Missoula County. 34 of those cases were identified by testing, and 2 were epi-linked. We have 24 cases that have recovered, and we've had 1 death. We're monitoring 168 close contacts who are in quarantine, and over 1,440 tests have been completed in Missoula County. The state of Montana has had a total of 422 cases and 8 deaths. First, I want to talk about the testing center. I announced earlier this week that our drive-through testing center at the Missoula County Fairgrounds is able to test anyone with COVID-19 symptoms. If you're a Missoula County resident or a Missoula healthcare worker with symptoms of COVID-19, such as cough, shortness of breath, or fever, please call our hotline at 406-258-INFO, that's 406-258-4636, and select option number 2 to get an appointment. Our nurses are available to take callers Monday through Thursday to schedule people for available clinic times. If you call on a Friday, we will refer you to a local healthcare provider for testing services. And I just want to remind everybody that it's important that you call and actually schedule an appointment and don't just go out to the fairgrounds. We are scheduling appointments so that we can avoid people waiting in long lines in their cars trying to be able to get through. The next thing I want to talk about is a decision that was made by the Board of Health yesterday. So yesterday, the Missoula City County Board of Health adopted a recommendation that all members of the public and employees and volunteers serving the public wear a cloth face covering over their nose and mouth when they're in public and unable to social distance. The recommendation was an effort to protect the health of essential workers and members of the community. The recommendation does not replace the need for social distancing, but rather it provides additional protection to members of our community from pre-symptomatic spread. It applies to members of the public when doing essential shopping, as well as to employers or volunteers who serve people in stores, pharmacies, and other such settings. The recommendation would not apply to those who cannot wear cloth face coverings if it's contraindicated for their health or if they can't wear them properly due to age or ability. The Board of Health didn't make it an order and hopes that the community will just embrace the recommendation so that an order can be avoided. The goal of this is that we want to normalize face coverings to help protect each other and to help protect our essential workers. I want to again remind people that you can make a cloth face covering out of items that are easily found at home, such as scarves or bandanas. Face coverings do not need to be sewn or specifically made for this purpose, although I know that there are a lot of face coverings out there that have been sewn for this purpose. Cloth face coverings should also not be confused for surgical or N95 masks, which are needed for healthcare workers and first responders. The face coverings must cover your mouth and your nose, fit closely to the sides of your face, and you need to be able to secure it with loops around your ears or with ties, unless by design it can fit tightly around your face. The covering should also have several layers of fabric but not restrict your breathing. If you use a scarf or a bandana, you want to make sure that you fold it a few times before wearing so that you have a few different layers. If you've made one, ensure that there are several layers of fabric in the face piece. Our website has videos and instruction on how to make face coverings using different methods and materials that can be found at missoula.co/cvirus. So now I'm going to show you how to put a face covering on and properly take it off. So first you want to wash your hands before putting on your face covering, as touching your face with dirty hands could risk exposing you to the virus. So you need to do this at home before you go shopping, but certainly don't put it on after touching a shopping cart or another surface that could have the virus on it. You want to make sure that it fits across your nose. So I'm just going to demonstrate. I have one here that has elastic. You just want to put it on, loop it around your ears like this, make sure it fits tightly, covers your nose and your mouth. When you are done, you want to make sure that you take it off, touching the strings and not touching your face. You want to wash the covering with soap and water or toss it into the washing machine. Don't set it on surfaces of your home that could lead to contamination. Put it in a laundry bin or a bag or another area that will protect the surfaces. One thing that I just want to remind people that it is very important that once you actually put your face covering on, you don't want to be touching it or trying to adjust it, because the more you touch the covering, the more you risk contaminating your hands or your face. So when you are done and you take your mask or face covering off, you want to make sure that you wash your hands when you're completely done. So on the topic of helping out our essential workers, and in addition to face coverings, we want you to consider a few things related to shopping. So the governor's directive limits shopping to essentials. Please don't just go wander around the grocery store because you're bored and there's nothing else to do. You want to be organized, try to have a list, try to have a plan, be as efficient as possible with your shopping trip. It's important that if it's at all possible to send one adult. I know that that's not always possible. If you're a single parent, you may not have other options for your children. But if it is possible, please try to limit the number of family members that are going into the store with you. If disinfectants are available for shopping carts and baskets, please use them. Try to stay at least 6 feet away from other shoppers and employees. Follow the social distancing guidance that the store has. Help employees of these stores protect themselves by decreasing the things that they have to touch and following their instructions. When possible, use online or phone options for ordering, payment, or to seek information rather than going in person. We just need to help out those who are still having to go to work to keep things moving, make sure that we have food, prescriptions, healthcare, and access to necessary services. So by decreasing the number of people in stores and providing space when needed, that's the best thing that we can do to help protect our community. We've gotten a couple of people asking about gloves and face masks on people making food. As we've said before, there's no evidence that you can get COVID-19 through your food. So if a food handler is pre-symptomatic, you are not at risk because they made your sandwich. If you're in the public area with them and within 6 feet, you could be at risk, just as you could be pre-symptomatic and putting them at risk. So requiring food handlers in non-public areas like in the kitchen to wear face coverings would not be protective for you, but it would be something for the business owner to consider to protect employees from exposing each other. The best move would be for business owners to provide enough space for social distancing in the food prep areas, or stagger shifts so that there are fewer people in the kitchen all at one time. However, areas where essential workers in the public interface, such as ordering or food pickup areas, are good places for face coverings for both you and for them. As for gloves, food service workers wear them when handling ready-to-eat food to protect the food from getting contaminated. Gloves are not needed beyond that for COVID-19 prevention. Hand washing is much more protective. Remember that gloves are not a sanitizing surface, and they're simply a barrier. If people wear them and touch different surfaces or do different tasks, they provide no additional protection, but could provide a false sense of security. So the last thing that I want to talk about today is an article that came out in the newspaper. We've had some people reach out to us concerned that the article discussing recreational social distancing sounded like we're implementing new requirements. We are not. We do work closely with our partners at Parks and Rec, as well as recreational groups and clubs, to ensure that people have information to make good decisions. We're not mandating anything, but we do recommend that people provide at least 6 feet of social distancing, and consider that the 6-foot measurement came from studies that looked at quiet air and immobile people. We don't know if this number is enough for people when moving vigorously, and there are articles and club guidance that recommends additional distancing for people if you are running or riding a bike. While we cannot require more than a 6-foot distance, recommending at least that distance won't do any harm, but may actually provide some additional considerations for those that are trying to practice a healthy lifestyle. We are fully in support of people being able to get out and hike and recreate and, ride your bike. It is spring in Montana. That is part of our healthy lifestyle here, so we definitely support that. We just want to remind people that the 6-foot space that is recommended really did only take into account when you're sitting inside a room and you need to have that space between people. So we don't know how much farther this virus could spread if you're in a windy area or if you are moving. So I just wanted to clarify that because we've had several people reach out to us with some concerns about that. So that's it for my daily briefing today. I hope everyone has a wonderful weekend, and as always, you can subscribe to me on YouTube. That's under my name, Cindy Farr, CindyFarr. Follow us on Facebook. There's lots of great information that gets posted there. You can check out our website at missoula.co/cvirus. Call 258-INFO if you need to schedule an appointment for a test, or if you just have other concerns or questions about COVID-19. There are people there Monday through Friday from 8 to 5 that can help answer those questions for you. So as always, thank you for everything that you are doing out in our community to keep your people safe, and please stay healthy, and I will talk to you again on Monday.